So I might just move this off to the side. I can just do it like that, okay? Then I'm going to, do I have a partner? Would you mind ambooing him for me? And I might actually listen to his lungs while she's ambooing him to get an idea. I probably will want to know what he's at rest first, so I'll probably listen. Say, oh, he's got a little congestion in your upper lobe. I think if I suction you, we can clear that up and I'll listen afterward. I'm going to check his pulse oximetry. It's in the low 90s. I'm going to check his heart rate. It's in the low 90s. So when I'm done suctioning, I expect to be able to hear clear air into the upper right lobe. I expect his pulse rate to go down. Now in this case, because we have the trach, you can take this, the face mask is a good idea to have in the room, because if we lose the trach, we could always go to amboo to the face, through the mouth, right? But we can use, these are universal attachments, so you can go ahead and just amboo in right there.
How many times?
About
One
every 3 seconds.
One every 3 seconds for 1 minute.
Okay, and this would be connected to oxygen at 100% if you had capacity to do that. I like having 2 ways to connect it, because then I can always have my amboo connected, and I can always have my trach collar connected, and I don't get in a hurry and forget to put it back.
Do we have 2 connectors
We
on
don't.
this one?
No.
Oh, okay.
But I like it when we do, because then you don't have to worry about it. And I tend to forget things when I get in a hurry, and that's one of the things you don't want to forget is leave somebody on 100% oxygen when they only need maybe 30%, because then you have to start that whole weaning process all over again, or you might knock out the respiratory effort by doing that. Okay, so then, so now I'm going to suction him. Head of bed up, however they're comfortable. You do want to have access, so sometimes you might think of a head roll behind them, so you can easily, like when you think of little babies with their short necks, you might want to have that area so you can see it. So I'm going to open my kit. I'm going to open my saline and have that ready to go. Okay? I can't see. Well, this is handy. Okay, so I'm going to just touch the cuff. You call me if you see something really gross that I do.
You're supposed to take a step back, aren't you? Because you're not over the field.
Well, above is okay, really. I'm not going to, there's not going to be room in the room to do that, probably. I know they don't like you over the field. I just went through that with somebody changing a, it's hard to see where the thumbs are. Okay, so I've got my gloves on. I'm going to use this hand for suctioning, right? I'm going to use this hand to put the cannula on down, this one for suctioning. Okay? Everything is sterile right now, right? This is a little container for the saline that I need. Okay. As soon as I touch this hand is dirty. So I'm going to put my saline in. And I can't pour it from high above, sorry. I guess I could hold it up and pour it to the side. Some kits will come with the water already in it and ready to go. Okay? So now I want to check my suction. It's on. I want it less than 120. Okay? Here's my suction thing. I have suction. I'm going to connect this. I'm not going to touch these 2 things. And then I can take this off. Okay? Make sense? It's been 100 years since I've done this. Okay. Are you filming this whole thing?
So I can remember later.
Okay.
I won't YouTube
now,
it, don't
if
worry.
he has secretion coming out, some people, if they think it's going to be a dry going in, they might lubricate it with a sterile saline here. Okay, just to lubricate the outside. He's got a lot of secretions in there, so I'm like, okay, can I take a really deep breath for me a couple of times? And he's going to do that. That'll give him some supply of oxygen. Okay, I'm going to go in with the tube now. No suction going in. Coming out, not longer than 10 seconds. I look at what is a COPA that we learned.
Wait, how did you do that? Yeah. Why do you have your thumb over that?
That gives us suction.
So when you put it down, you have suction? So when you're going in, you don't want to have any. When you come out, you have suction.
So suck on the way out.
He had some big goobers in there. I might have my partner amboo him again, or I might put the blow-by on for him to take some deep breaths. Again, it depends. It might be amboo. Okay?
I'm sorry, what's the blow-by?
The
That thing?
blow-by is this
Okay.
thing here, okay? So you'll do it until what? Airway's clear. His pulse oximetry is better.
So will you have somebody else listening?
You could,
Since
if
you're
it's a real
sterile
intense thing.
thing.
Lots of times you hear that the secretions are gone because it makes that sound, okay? So you'll hear that, you'll know they're gone. Usually, as you go in, now if I was a real good Nancy nurse, which I obviously am not a real good Nancy nurse, I would want to know about how long that tube is. And one of the books said you could compare it. Some people will put a drawing of the tube up on the wall somewhere so you can actually measure how far down you want to go. So you might go down that far because that's going to give you 2 centimeters beyond the end of the tube, okay? I don't know whether I'll have those up for you to do or not. I might be able to do that next week for you so you can see. Okay? I'm going to do it one more time. I want you to cough. Usually when you get down to a certain spot, they will cough automatically because that's an irritant in their lungs. The rotation coming out isn't real critical, but people do it. And it still says that in the book.
So once you've done it once, you can still go back in?
Now I can't keep this suction catheter and use it again. Once I'm finished with this event, I'm done.
Right. I just meant like while
Yeah.
you're doing it
Yeah.
once.
Yeah.
So when you went in and you came out, you can still go back in with the same catheter?
Yeah.
Okay, but you
It's
won't
just
use it
that
the next
when I'm
time?
done, I
Right,
can't
okay.
use it again. Okay?
Okay.
So now I'm not hearing the rattle. Are you breathing a little bit better? Yes.
Can he breathe right now with just
Yeah.
having that?
Yeah.
Okay.
Yeah. Yeah. And when I'm by myself, I might actually have this right over by that with
Okay.
my good hand. And some people will actually amboo with one hand. It's a little trickier. If you've got a ventilator, you can push the side button with your dirty hand and get the same thing. Okay? Makes sense?
Mm-hmm.
Clear this. I usually do like this to dispose of it. Usually there's a little holder. I don't see the holder. The supplies all go in the trash. I'm going to go back with my stethoscope, listen, check my oxygen, check my safety, listen to the lungs, see if I've improved his condition. I might do some teaching, like tell me next time if you need suctioning, I'm just down the hall. Or I might say, you know, you're going to have this to go home. When are you going to be ready to start doing it yourself? I'll be happy to help you learn anytime you're ready. Whatever is going on in his case, I'll prepare him to do. That just fell, didn't it?
Yeah. Not to the floor.
Usually they have, on these things, they usually have a little hanger right here or somewhere, and I'm not seeing it. That looks really cool. You just set it in there. Some places leave the suction on all the time, some places don't. So that's why you always check it. Because it's really a pain when you get there and you don't have suction, especially if they're really coughing up big goobers. Because sometimes they'll cough and you can catch that big goober, and you've been waiting all day to get that out of there, you know, and you hate to miss it when it comes. If they're really thick and slimy, I usually have to control some retching, because it's one of the things that really gets me in the gut, so be prepared for that. Talk to yourself before you go in. Try not to vomit on the patient. Right. And then you're going to put everything back. If the inner cannula is gunky and you can't get it cleared, you can change the inner cannula. You can take it out. This one's really in there tight. So you would take it out with your, you could take that out with just a clean pair of gloves. If you're not doing disposable ones, you would put it into whatever solution the hospital cleans it in with your little pipe cleaners and your brushes. You might clean it, you would suction him. If you put the clean one back in, you'd want to make sure it was dry and rinsed. You don't want anything like hydrogen peroxide or whatever the cleaning solution is going into there again, so it's usually rinsed thoroughly. Then you would either have your new one ready to put in, or you'd put the old one back in. Sometimes it might require suction. This one is really tight. I don't think it's the right inner cannula.
And they can still breathe when you pull that out.
Yeah, because
Okay.
they've got their airway.
Okay.
But usually you suction that outer one before you put it back in.
Right.
Make sense? And then if they need a dressing, you would use, have you seen those 4x4s or
the
2x2s that have the
cut ones.
slit already? And usually they come up from the bottom and go under. If you need to change the trach ties because they're dirty or soiled, you would probably have your second person to stabilize it. Something like this is probably disposable. I would probably just cut it off. Sometimes those knots, if there's knots, get really slimy and messy. Same way with a Velcro. While you're trying to pull that off, you can do a lot of jiggling on the tubes, so you want somebody to stabilize that. Make sense? Fairly easy procedure, right? The hardest part that you'll have is knowing which hand is sterile and which hand isn't, and keeping that straight through the procedure. And remembering to pour your saline with the right hand. Maybe opening up your saline bottle before you start. So at least you can get the lid off with one hand.
And then after this, we're going to go ahead and reassess them, listen to their lung
You'll
sounds.
do the whole reassessment. Now, I'll tell you right now, you can do a lot of things wrong manual dexterity from me because I know it's only your second or third time maybe practicing to do it. But if you forget the pre and post assessment, because that's what nursing is. I can teach a 10-year-old to suction themselves. So repetition does wonders for learning the manual dexterity skill. The skill of assessment, knowing what questions to ask and what data to gather, is what nursing is about, okay? And it's knowing why you're doing it and if you've been successful. Because you don't want to leave them in a worse way than you came into it. Okay, go forth and